Every year, the World Economic Forum brings together 100 emerging startups with the vision of fostering a global network for cutting-edge, innovative entrepreneurship. Started 2 decades ago, the community boasts of an impressive group of alumni, the world's biggest tech companies from Google and Airbnb to Wikipedia and Spotify. Those have all been part of the Pioneers list. Now, joining the coveted Tech Pioneers list this year are 3 Indian startups that are leveraging new technologies to find solutions to old problems, health and climate. Let's start with the first. Giftolexia helps children realize their true potential through early identification of dyslexia. The startup's machine learning-based screening solution with eye-tracking goggles and IoT-enabled smart posters identifies the risk of dyslexia in children within 5 minutes. Next up, 3D bioprinting, which can bridge the big organ transplant gap, which has some patients on half a decade-long waiting lists. That's the belief with which the next big innovation labs was founded. The deep tech life sciences company says its invention can transform the world of medicine. And finally, Blue Sky Analytics. It aspires to build the world's largest green database with the power of satellite data and artificial intelligence. It hooks all environmental monitors to a unified platform which provides warnings to prevent disasters, both human and economic. Hello and welcome to Young Turks, India's longest-running show on startups and entrepreneurship. I'm Shereen Bhan. It is my absolute pleasure to welcome on the program today 3 tech pioneers who represent India as part of the World Economic Forum. That list that is out today with me are 3 women founders who are at the cutting edge of technology, looking to create solutions for a healthier planet as well as its people. Teena Paul, the CEO and founder of Giftolexia, Abhilasha Purwar, the founder and CEO of Xacmaz, and Pooja Venkatesh, the co-founder of Next Big Innovation Labs. Ladies, thanks very much and congratulations to the 3 of you. You know, we've been partnering with the World Economic Forum to put the spotlight on tech pioneers for many, many years now, and I can safely say that I don't believe we've had 3 women founders in the tech space on one program together in a really long time. So this is particularly heartening and congratulations. But Teena, you know, I want to start by talking to you about Giftolexia. If I see your journeys, Abhilasha, Pooja and Teena, you're all around the same vintage. Your companies, your startups started about 5 or 6 years ago. But Teena, the idea for you to actually start up was a personal one, and it was first something that you started toying with way back in 2012. Take me through the startup journey.
My youngest son was identified with dysgraphia when he was about 13 years of age. But with the support of good special educators, he was able to complete his graduation. He graduated from the National Institute of Design. He was even the president of his college. But he was identified too late. 13 is too late to get identified with learning difficulty. So we have brought in a solution that can identify children with learning difficulties as early as 7 or 8 years of age. So you get 4 to 5 years to help the child with intervention programs to go through class 10, class 12, and then choose the path that they want to do. So we truly believe that people with dyslexia, as the name suggests, dyslexia is a gift, but you need to identify it early and give the children the right intervention support so they can go on to do really realize their true potential. So we have been supported by...
you know, what a great example.
Yes, yes.
No, I said, and what a great example that you've just shared with us, the way that your son has been able to realize his potential, and you're hoping to do that for other children as well. But, you know, Teena, you're right in pointing out that the average detection age in India averages between 11 and 12 years. And as you pointed out yourself, that's already too late. Now, yes. I want to understand from you, how have you been able to solve for this? Your tool is a machine learning, deep tech-based screening tool. Take me through the process of being able to put this together and how you now deploy it at scale.
Okay. So when we started 5-6 years ago as the WSP cohort at NSRCL at IIM Bangalore, we were hoping to license the solution from a Swedish firm. But then we realized the licensing costs were very, very high. So we partnered with an Indian firm that makes the goggle, and we developed a solution to collect gaze data. So the child wears an eye tracking device and reads text that's projected either on a TV screen or a smart screen. And this particular gaze data is analyzed using machine learning algorithms, and we come up with a risk, no risk. So the intent is to help these students start intervention early on. And because an assessment is a long drawn out process and it's very costly, we don't have really the infrastructure to assess all the children. So have a very easy screening where all the children in a class can be screened, and we can come up with the result. And all of this takes about 5 to 7 minutes per child. So yeah. So
well,
we go to
in 5 to 7 minutes, that can make the difference. Yeah. Absolutely. This can make the difference between a child being able to realize his true potential if in fact diagnosed with dyslexia, which of course is a learning disability, and be able to intervene at the right time with the right tool to make a significant change in their ability to move forward in life. But Abhilasha, I'll come back to you, Teena. But Abhilasha, I want to talk to you about Blue Sky Analytics. And you started in about 2018. And the idea really was to try and put data together on dealing with the problem of pollution. Quite literally, that was the starting point.
It was a very, very great day in Delhi. And when we looked outside as young founders, the only aspiration at that moment was that in a few years, if we can get blue sky, that'll be like one of the biggest achievement. We started from air pollution, but then extended our innovation to all aspects of climate and environment, to water. And currently, as Delhi and pretty much most of North India is reeling from floods, our ability to be able to monitor rivers and lakes and all the water bodies with satellite data and AI is essentially really coming along. And I think the journey for us in the next 5 years is going to be very sort of exponential and with very high potential for both impact and change, because it is the most pressing issue that the planet is facing, and whatever we are building is of the dire need.
Oh, I couldn't agree with you more, and I don't know what the data is telling you, but I'm sure it's flashing red on your dashboard, because there isn't a city at this point in time in the country that is not inundated with one kind of climate crisis or another. Cities are flooded. In fact, today, alerts being sounded across the financial capital, and we're seeing how climate change is impacting lives as well as livelihoods. But Abhilasha, you spoke about the opportunity both to make impact as well as for change. Now, explain to me, what is it that you do? So you have access to all of this data. You're providing a platform that brings all of this data together. But what do you do with this, and who are you solving for? Who are your clients, for instance?
Definitely. So the problem with the climate data or general climate and environmental data, potentially even till today, is that it is not really accounted for in our decision making. If we just take the whole Delhi flood situation, we could have taken steps to move people away from the floodplains 5, 6, 7 days ahead of the flooding coming. And we can do these similar things pretty much everywhere. So advanced warnings in the era of climate change is, I would say, of the utmost importance. And that's where our data and algorithms using satellite and AI, we build these data sets fundamentally. So we measure how much is the water level in a river, what is the probability of wildfire near a forest area, all those different kind of probabilities, which with 7 to 10 days warning can really save lives. That's the first part. But the second part is, I think, adaptability is very key. In the next 10 years, many of our decisions, much of our infrastructure will have to be changed. And where do we go? What do we build? How do we build? What is the risk? What is not? All of that needs to be thought and accounted for. And currently, the decision makers fundamentally don't have access to information to be able to incorporate in their day-to-day models and day-to-day decisions to take this impact. The overall gambit really falls under climate risk analytics, where banks and insurances are really becoming the key actors in taking the driving force and making our planet more adaptable. And I think last but not the most important, but the most important is carbon markets. We fundamentally have an ability or a potential to be able to stop or in some ways pause climate change or reduce the impact by and Indian government in the last budget really put forward a lot of points to make the Indian carbon market like really flourish. So whether it is reforestation, mangroves, or any kinds of projects across the world, there is a huge trust deficit at the moment. The potential of South Asia, and African subcontinent in the carbon markets is very thwarted even today because of the lack of the trust between the carbon markets, all the different players. And that is where companies like us really come in, where we are able to effectively do a digital MRV. So we are able to look from the satellites and tell if a carbon project is actually valid, if the carbon credits are true, or what the quantification is true. The overall, our dream is really to help all the decision makers, buyers, sellers, anybody selling an insurance product or doing an infrastructure investment, have access to information so that they can do right kinds of transactions, they can do right types of decisions. One of the initial articles about us paralleled us to Bloomberg of climate data, and I think in many ways it really holds true to what we're trying to build here.
Well, I like the way that you put it. You want to be the Bloomberg of green data. And I really do hope that some of our decisions, at least in areas that you spoke of, whether it's building out the carbon market or it is in the space of decisions that are linked to climate mitigation and adaptation, are based on data, because that is the need of the hour today. And we don't have enough time. We need to make changes. I'll talk about the advance warnings and, whether you see enough uptake from government organizations, from local authorities, etc., because those are at the front line of the battle, so to speak. But I'll come to you in just a second. Let me bring Pooja into the conversation as well. Pooja, many thanks for joining us, and congratulations to you as well. And I want to start by understanding from you your startup story. You decided to launch the company in 2016 along with your co-founders. What drove you to start up?
So I think basically, I had taken a break from work, and we then got together to look at how we can explore basically 3D bioprinting across various applications. And the most immediate one was to look at how 3D bioprinting can be used by clinicians to solve the gap that we are looking at and the abyss that we're looking at between organ donation and organ transplantation. So we see that the potential for 3D bioprinting as such as a technology is that, the holy grail for it is to develop organs within the lab, which can then be used as a transplant. As you know, there are a lot of patients out there, and the staggering numbers that you see on the organ donor registers are quite large. And, traditionally you see there is a lot of challenges with having to transplant organs in terms of, the very few donors. And the second thing is that the shelf life, as in to transplant them is very critical, the time frame. So, looking at all of this, we decided to look at exploring and venturing into 3D bioprinting. And this was a very niche technology at the point that we started off at. So, we then call ourselves a deep tech 3D biofabrication company that is working to develop a holistic, biofabrication platform, which then looks at translating 3D bioprinted organs from, bench to bedside. So we are working on multiple levels. Firstly, we develop our own engineering. That is, we develop our own homegrown 3D bioprinters, which are called 3DMA. And 3DMA is being used by researchers for a wide range of applications, ranging from developing novel biomaterials to developing, tissue models, disease models, which can be used as an alternative to animal models. And, it has also been used for developing clean meat. And, of course, the holy grail is to develop 3D bioprinted organs within the lab. We're also talking and in touch with, multiple stakeholders. We're talking to regulators, we're talking to policymakers, and also to get the right stakeholders in terms of, researchers and scientists working together using our platform, to develop the right regulatory guidelines can, then be framed to see how we can take 3D bioprinted organs, to transplantation and make that a near reality.
You know, I want to understand from you where you believe we stand in terms of the idea of making this a reality. But first, another similarity, I mean, what we heard from Teena, they decided not to go down the licensing route and decided to do this in-house. And pretty much like what we heard there from Teena, you've decided to take the exact same route and do the engineering and the R&D in-house as opposed to, you know, a licensing arrangement or looking outside. But when can it be a reality? Are we 5 years away, 10 years away? Pooja, what can you tell us?
Yeah, I think, I mean, when we did start off, it was very, very new and nascent, and we were looking at, you know, the horizon, trying to understand when this can become a reality. But today, in the current scenario, I can tell you that, you know, FDA has come with guidelines, basically the Modernization Act. And also India has come with, you know, a new drug and clinical trials rule, which basically sort of mandates and pushes towards using, you know, alternates to animal testing in the drug testing, you know, drug testing field. So we have policies that are coming together, you know, to start using technologies like ours, you know, bioprinting technologies, to develop alternatives to animal models. So that's a good thing. So we have started there. And like I said, we are sort of, you know, trying to get the right stakeholders on board. We are talking to policymakers, we are talking to clinicians, and, you know, we are also bringing in the scientists and the biomaterial experts, as well as, you know, the technology coming, such as ours, coming into the fore to actually, you know, develop 3D bioprinted organs that can actually be used for transplant. Now we're looking at more of a, I would say, you know, 5 to 10 year sort of timeline, because you know, we are sort of trying to tackle the different complexities and challenges that are involved in developing you know, complex organs. So people across the world are looking at developing, such as ourselves, we're looking at developing the technology, right? The bioprinting technology, and bringing in AI, you know, to sort of automate that, and also get AI-based bioprinting solutions for clinical applications. And people are working on the other end of the spectrum, where, you know, we are trying to introduce vasculature, which is basically introduce the blood flow to the organ. And people are looking at one end of the spectrum, they're looking at developing biomaterials which are compatible to develop this, you know, complex organs within the lab. So I would say we are working, you know, with multiple stakeholders to get to that reality. And I would see it 10 years down the line.
Well, 5 or 10 years down the line, and I really hope that you see a breakthrough and that we see the kind of disruption that you speak of, because it is so needed at this point in time. As we pointed out at the start of the program, there are so many patients around the world, you know, on waiting lists, just waiting, hoping that they will be able to catch a break, and this could solve for that. So we certainly wish you the very best of luck, Pooja, to you and your team. But Teena, coming back to you, you know, to the point that Pooja was making, that at least as far as the move to 3D printing and taking that forward as far as commercialization for organ transplantation is concerned, it requires a complex regulatory architecture, a regulatory framework. In your case, I would imagine it's more about sensitization of the many stakeholders involved. Now, how do you scale this up? I understand that you're working with in different states at this point in time, from Maharashtra to Karnataka, and across different demographics as well. How do you scale this?
So, like, you know, one of the models for scaling is because this doesn't really require expertise to collect the data. So we were hoping that we could set these, like, you know, screening centers in public health centers, and even train the ASHA workers to collect the data, and we just do the analytics part. So that's the way that we can really scale up. So we really need huge government adoption for this. And like you pointed out, adoption is a big issue for us because there is still a stigma associated with any kind of learning challenge. Though children with learning difficulties have huge compensating advantages, we still, like, you know, there is lack of the right awareness. So, you know, huge, like, you know, issues with adoption. Yes.
But are you seeing a buy-in from governments at this point in time, Teena?
There is buy-in from the government, but that cycle is very, very long. Everybody we present this to says it's an excellent product. It's really good. But we don't have the budgets right now, and come back next year, or so it doesn't move as fast as we would like it to move. We've started approaching.
How much would it cost to screen? How much would it cost to screen a student using Giftolexia's tool?
So at this point of time, it's 500 for private schools, and we give it at a 50% discount to government schools. So the other option is
that's really, yeah, that's really not a lot of money when we talk about the kind of impact that it could potentially have on a child's life. But Abhilasha, the same question to you. You were talking about making better decisions on the back of the data that you assimilate and put together. Are you seeing a buy-in from governments, from local authorities? Because at the end of the day, they're the ones in positions of power who need to make those decisions.
When it comes to climate and environment, it has always suffered from this tragedy of commons, where government and local authorities across the world are typically your de facto buyer. But as Teena mentioned, it's not just in environment and climate, the budget is immense. Like, the kind of budgets allocated globally are in billions of dollars. But the sales process or the buying processes are so complicated, riddled with inefficiencies and so on and so forth, that I think for young startups like us, it is definitely primary challenge. The climate tech in general as a sector, because your user and the client are not always the same. When you're selling a skincare product, I'm selling it to you, you are buying, you're my user, you're my consumer. It is a very simpler dynamics. But when it is, for instance, media or climate tech, when the person paying you the bill and the person who's using or is going to have the utility is not the same, there is definitely a challenge of figuring out monetization. There are few avenues where we have found easier pathways. Sadly, they are not the most impactful avenues. And the avenue where we can make the most impact, save the most amount of lives, there we do face a challenge of navigating the government buying process.
Yes, I would imagine that is the case. So clearly at this point in time, capital for you is not a challenge, because there's plenty that's sloshing around towards climate tech, and you've already been able to raise $1.5 million. But Abhilasha, what's the roadmap? What's the 5-year timeline or milestones that you've set for yourself on where you would like to take the company?
I think on the capital front, definitely overall the allocations of capital and climate, the overall dry powder is extremely high. However, we are probably in the entire startup world living through the driest markets ever. And in some ways, I think it's a blessing in disguise, because for a company like us and any company, it is really forcing you down the disciplinary route, where you have to figure out the monetization, figure out the business model. So the 5-year plan for us is to kind of really focus on two aspects. One is the business model, the monetization, and the clients. But on the other side, the second would also be continuing our efforts toward impact and also having it as one of the priorities. And walking that balancing rope is a challenge, but we hope to be able to excel in it and have both an exceptional business model, but also make a lot of impact through various means.
Yeah, I would imagine. But Pooja, you're looking at raising funds at this point in time. How challenging has it been? How challenging does it continue to be? As Abhilasha was saying, there's lots of money around. People are sitting on dry powder, but it's perhaps the driest summer, winter, whatever you'd like to call it, that we've seen for the startup ecosystem in the last few years. So how much of a challenge is that for you? And two challenges, affordability and accessibility, both those challenges, you're trying to solve for. What have you been able to do in order to meet both those fronts?
Yes. So just to answer your question, so we've been completely bootstrapped at the moment, Shereen, and we've been revenue positive in the last fiscal year. And yes, we are looking to actively raise funds, and we're talking to the right sort of partners who do invest into deep tech. because ours is something, like I mentioned, right, we need, the right stakeholders on board, and we need to push for, regulatory approvals and acceptance. But, like I mentioned, regulations have come in place where they have, pushed for alternative models and recognized, 3D bioprinting as, the next gen tech that can actually be used for, different applications, like I mentioned, to develop models as an alternative to animal testing for pharmaceutical or cosmetic companies, and of course to develop something as revolutionary as developing 3D bioprinted organs in the lab that can be that can go for transplantation. Now, having said that, along the way, what we have done is we've bolstered ourselves, and we've had some fantastic partnerships along this way, where we have, tied up with Microsoft, where we are using their AI platform to develop AI-based bioprinting solutions, which is going to be a game changer again for clinical applications. We've also had a strategic collaboration with High Media, which is again a homegrown life sciences company that delves into cells and media, and their vision very much aligns with the vision of NBIL, and we want to collectively sort of take this leap into not just being a Me Too, but more to be a true pioneer in the field of biofabrication. So, we along the way, we have sort of garnered multiple partners, to sort of bolster our technology, innovate on our technology, so that we are one step ahead of our competition. So this has been our journey so far, and like I mentioned, we've been
well, you're certainly you've made it to the pioneer list already. So it can only go, it can only move higher from here on. But 10 seconds exactly, I'm going to give you all the final comments. Teena, I'll start by asking you: global aspirations. You want to take this outside of India?
Absolutely. GCC and Africa will be our next stops once we have, done enough in India. So we are looking for, support
Abhilasha?
Governments across India.
Right.
Because there are regulations in place to screen all the children. The RPWD Act talks about it, but adoption is still an issue for us. Yes. Thank you for having us on the show.
Okay. Abhilasha? No, my pleasure, Teena. Thank you so much. Abhilasha, global ambition?
Climate change is a global problem. Our solution is and has to be global. So we're really focused on, in carbon markets, Southeast Asia, Global South, I think, Southeast Asia, India, and Africa. But as far as like climate risk analytics is concerned, Japan, Europe, and New York would be our sort of like go-to markets and focus areas.
Well, Teena, Abhilasha and Pooja, we wish you the very best of luck. Thanks so much for joining us here and taking us through the breakthroughs that you've been able to achieve, but more importantly, the impact that you hope to make with your tech companies that you founded. We look forward to hearing more from each one of you on your plans going forward. Thanks very much. We wish you the very best of luck. That's it then on this edition of Young Turks. From all of us here on the team, for now, goodbye. Thanks very much for watching.